All right, we're going to be talking about a condition that affects millions of people, but often does it in complete silence. It's called atrial fibrillation, or AFib for short. We're going to break down what it is, why it's a really serious health concern, and most importantly, what you can actually do about it.
You know that feeling, right? That weird little flip-flop in your chest? Now, it can be caused by a lot of things, sure. But for some people, that's the first sign of AFib. And this is a big deal. It's the most common type of irregular heartbeat, and it's on the rise. We're talking over 12 million Americans are expected to have it by 2030.
So what is actually going on inside your chest during AFib? Well, normally the top two chambers of your heart, the atria, give a nice, strong, steady squeeze. With AFib, they just stop doing that. Instead, they kind of quiver, almost like a bowl of Jell-O. And that little quiver, that lack of a good pump, is where all the trouble really starts.
Okay, so here's our game plan to get a handle on all this. We'll start with the basics of what AFib is. Then we're going to jump right into the single biggest risk. After that, we'll look at a simple way to think about treatment, dive into the options, and finish with the most important part of all, you and your doctor.
So first up, what does AFib actually feel like? Well, here's the thing. It's different for just about everyone. And that's one of the reasons it can be so sneaky and hard to pin down.
The list of symptoms is all over the place. I mean, you might feel that classic flutter, or maybe you just feel tired all the time and can't figure out why. But here's the absolute key, the most important part of this slide. Some people feel nothing at all. Their AFib is totally silent, but the danger is just as real. And I have to say this very clearly. If you feel chest pain or pressure, that is a medical emergency. You need to get help right away.
That silent risk I just mentioned? It leads us straight to the single biggest reason AFib has to be taken so seriously. Its direct and powerful link to stroke.
Just look at that number, 5 times. Let that sink in. If you have AFib and it's not being treated, your risk of having a stroke is 5-fold or 500% higher. It's a shocking statistic, and it's exactly why managing this condition is so critical, whether you feel sick or not.
So you're probably wondering, how does a heart problem cause a brain problem? Well, it's like a 5-step chain reaction. It starts with that irregular beat, that quiver. Blood doesn't flow through properly, so it starts to pool up, especially in this little pouch on the heart. And what happens when blood just sits around? It clots. If that clot breaks free, the heart can pump it directly to the brain. It gets stuck, and that causes a major stroke.
Okay, I know that sounds scary, but understanding the risk is step 1. Step 2 is actually doing something about it. And luckily, doctors now have a really simple, easy-to-remember way to think about treatment. Just think of it like you're sending out an SOS for your heart. The first S stands for stroke risk. That is priority number 1. O is for optimizing all the things you have some control over. And the last S is for symptom management. This framework is so smart because it's not just about a single pill, it's about looking at your whole health picture to get the best result.
So if we're following that SOS plan, we have to start with that first S, stroke risk. And that means preventing those dangerous blood clots. For decades, this has been the absolute cornerstone of taking care of AFib. For the longest time, the main tool in the toolbox was a drug called warfarin. And look, it works, but it can be a hassle. You need constant blood tests, you have to watch what you eat. But now there's a newer class of drugs called DOACs, and they have been a total game changer for so many patients. They work great, but you don't need all that monitoring or strict diets. It's just a much easier way to stay protected.
But hey, blood thinners aren't for everybody. Some people have bleeding risks that make them a bad idea. So what do you do then? Well, this is where medical tech gets really, really cool. There's a mechanical fix. Take a look at this. It's called a left atrial appendage occluder. Remember that little pouch where blood clots love to hang out? This device basically acts like a tiny plug that seals that pouch off from the rest of the heart, forever. It's a one-time procedure, it's minimally invasive, and it solves the problem without any long-term medication.
Okay, so we've covered preventing a stroke, but what about that final S in our SOS plan? Symptom management. This is where we talk about procedures that go right to the source of the problem, to try and get the heart's electrical wiring fixed.
One of the main ways they do this is with a procedure called catheter ablation. Now, it sounds complicated, but the idea is actually pretty simple. A specialist goes into the heart, finds the exact cells that are misfiring and causing the AFib, and then uses either heat or cold to create tiny scars.
Those scars block the bad electrical signals and hopefully let the heart get back to a normal, steady beat.
Of course, the big question is always, is it safe? And look, any procedure has some risks, but the data from the American College of Cardiology is pretty clear. Out of thousands of patients, the overall complication rate was around 4.5%. Serious complications, less than 2.5%. And the risk of death from the procedure was incredibly tiny, just 0.06%.
And you know what's even better? These numbers have actually gotten lower over the past decade. That's medical progress for you. It means this procedure is safer today than it has ever been, which gives both doctors and their patients a lot more confidence.
So, we've walked through what AFib is, the risks it carries, and the amazing treatments that are out there. But none of it works without this final, most important piece of the puzzle. And that piece is you, working together with your doctor. This isn't a situation where there's one right answer for everybody. Deciding on medications or if a procedure is the right move for you, it's a conversation. It's about your goals, your lifestyle, what you're comfortable with. It's a true partnership.
And that just brings everything full circle. Just listen to this quote from a patient named Jane. She said, "I didn't have any symptoms. She felt fine, but she knew she was still at risk of a stroke, and it was taking action based on that partnership with her doctor that ultimately kept her safe." So, we've covered the what, the why, and the how of atrial fibrillation. The most important part now is what you do with this information. The next step isn't something you'll see on a screen. It's the conversation you're going to have with your doctor. So think about it. What's your first question going to be?